Have you ever wondered how a leaky faucet can be similar to a heart condition? It might seem like a reach, but this analogy will help us comprehend aortic regurgitation, a cardiac condition that's all about leaks and backflows. Picture the human heart as a pump and the aortic valve as a faucet. Under normal circumstances, this faucet should close tightly after each pump, ensuring a one-way flow of blood from the heart to the rest of the body. But in aortic regurgitation, the faucet or the aortic valve doesn't close as it should. This malfunction allows some blood to leak back into the heart's left ventricle with every heartbeat, just like water dripping backward from a faulty faucet. A fascinating yet complex condition, isn't it? And we're just scratching the surface, so let's dive deeper into understanding this condition. Imagine, if you will, the heart as a pump with 4 chambers. The aortic valve is a critical component of this pump. It's like a door that separates the left ventricle and the aorta. When the heart contracts, this door opens, allowing oxygen-rich blood from the left ventricle to flow into the aorta, which then distributes the blood to the rest of the body. Now let's focus on what happens when this door, the aortic valve, doesn't close tightly. It's a condition known as aortic regurgitation. Picture a busy highway with cars steadily moving forward. Suddenly, there's a glitch. A handful of cars start moving backward, causing chaos and disrupting the smooth flow of traffic. That's basically what happens during aortic regurgitation. Instead of all the blood moving forward into the aorta, some of it leaks backward into the left ventricle during each heartbeat. This isn't ideal for the heart, which is designed to work as a one-way pump. The backward flow of blood means the left ventricle has to accommodate more blood than it's supposed to. It's like a party host who's prepared for 20 guests but suddenly finds themselves with 30. The host has to scramble to provide for the extra guests, which can be quite stressful. Similarly, the heart has to work harder to pump this extra volume of blood. Over time, this can cause the muscle of the left ventricle to thicken and enlarge, a condition known as ventricular hypertrophy. It's like the host deciding to add more chairs and tables to accommodate the extra guests at future parties. But this workaround solution is not sustainable in the long run. This is why it's crucial to address aortic regurgitation promptly. It disrupts the heart's optimal function and can lead to other complications if left untreated. Just like a leaky faucet, some of the blood leaks back instead of moving forward efficiently. But what causes this leakage in the first place, you might wonder? Well, there are a couple of main culprits we need to talk about: valve abnormalities and aortic aneurysms. Let's start with valve abnormalities. These are essentially any conditions that damage or deform the aortic valve. One example of this is rheumatic fever, a disease that can develop after a strep throat infection. This illness can leave the aortic valve scarred and stiff, preventing it from closing properly. Congenital heart defects, conditions that a person is born with, can also cause aortic regurgitation. These defects might involve an aortic valve that has only 2 leaflets instead of the usual 3, or a valve that is not shaped correctly. Infections that affect the heart, such as endocarditis, can also damage the aortic valve. Endocarditis occurs when germs, usually bacteria, enter the bloodstream and settle in the heart, most often on a heart valve. If left untreated, this can lead to aortic regurgitation. The second major cause of aortic regurgitation is an aortic aneurysm. This is when the aorta, the main artery carrying blood out of the heart, becomes enlarged or bulges outwards. Conditions such as high blood pressure or atherosclerosis, a buildup of fats and cholesterol on the artery walls, can cause an aortic aneurysm. When the aorta enlarges, it can pull the aortic valve open, preventing it from closing properly. This is similar to stretching out a rubber band. If you pull it too much, it won't snap back to its original shape. Aortic dissection, a serious condition where the inner layers of the aorta tear, can also lead to aortic regurgitation. This can cause blood to flow between the layers of the aortic wall, forcing the aortic valve to open wider and potentially preventing it from closing correctly. In a nutshell, whether it's valve abnormalities or aortic aneurysms, these factors can lead to the aortic valve not closing as tightly as it should, causing the backward flow of blood into the left ventricle and resulting in aortic regurgitation. Now let's move on to the symptoms and effects this condition can have on the body. So, how does this valve leakage affect the body? Aortic regurgitation, much like a stealthy infiltrator, often begins its assault unnoticed. In the early stages, it doesn't usually exhibit any symptoms. However, as the condition progresses, the body begins to feel the strain of the leaky valve. Imagine feeling inexplicably fatigued, as if you've run a marathon without even leaving your chair. You may experience shortness of breath, Even when you're resting or sleeping, you might feel a tightness or pain in your chest as if someone is squeezing your heart. And then there are the palpitations, that unsettling sensation of a racing or irregular heartbeat that can make you feel like your heart is doing somersaults inside your chest. But what's happening inside the body during aortic regurgitation is far from a gymnastic feat. As the aortic valve leaks, some of the blood that should be powering your body is instead trickling back into the left ventricle. This is where the heart showcases its resilience. It begins to pump more blood during each beat to compensate for the backflow. However, this compensatory mechanism is a double-edged sword. On one hand, it ensures that your body continues to receive the oxygen-rich blood it needs. On the other hand, the heart is essentially doing extra work with every beat. Over time, this increased workload can cause the walls of the left ventricle to thicken in a condition known as ventricular hypertrophy. It's as if the heart is a bodybuilder, growing larger muscles, or in this case, thicker walls, to handle the increased demand. But unlike a bodybuilder, the heart doesn't benefit from this hypertrophy. The enlarged heart has to work even harder to pump blood, and it becomes less efficient over time. The heart's chambers may also enlarge and they can weaken, leading to heart failure. In essence, aortic regurgitation forces the heart to work in overdrive. And while it strives to compensate, it can become overworked and enlarged. This condition highlights the heart's incredible resilience, but also its vulnerability when faced with a relentless adversary like aortic regurgitation. Over time, the heart tries to compensate but can become overworked and enlarged. How can doctors diagnose this condition? Well, when it comes to diagnosing aortic regurgitation, the first step usually involves a physical examination. A doctor listens to the heart using a stethoscope. They're on the lookout for a sound known as a heart murmur. This sound, which is different from the typical lub-dub heartbeat, can be a key sign of regurgitation. But a physical examination is just the beginning. Doctors also rely on a series of imaging tests to help them see what's going on inside the heart. These tests could include an echocardiogram, which uses sound waves to create pictures of the heart in motion. Alternatively, they might use an MRI or a CT scan. These techniques give a detailed look at the heart's structure and functioning, providing a clearer picture of the aortic valve and any potential leakage. These tests help doctors visualize what's happening inside the heart. So, what can be done to treat aortic regurgitation? Treatment for aortic regurgitation is generally centered around two main strategies: managing symptoms and slowing disease progression, and in more severe cases, surgical intervention. In the early stages of aortic regurgitation, the focus is often on controlling symptoms and slowing the progression of the disease. This usually involves medications. For example, doctors might prescribe medications to control blood pressure and heart rate, such as beta blockers or calcium channel blockers. These medications help the heart to pump more efficiently, reducing the workload on the heart and potentially slowing the progression of the disease. Another class of drugs that may be used are vasodilators, which help to widen blood vessels, improving blood flow and reducing the amount of blood that leaks back into the heart. Diuretics might also be prescribed to help reduce fluid buildup in the body, a common symptom of aortic regurgitation. However, in more severe cases where the heart is significantly enlarged, or if symptoms become unmanageable, surgical intervention may be necessary. There are two main types of surgery for aortic regurgitation: valve repair and valve replacement. Valve repair involves fixing the existing valve, usually by reshaping or reinforcing the valve's leaflets to help them close more tightly. This is often the preferred option as it allows the patient to keep their own valve and reduces the risk of complications. In cases where the valve is too damaged for repair, a valve replacement may be necessary. This involves removing the damaged valve and replacing it with a mechanical valve or a biological valve from a donor. Each type of valve has its own advantages and disadvantages, and the choice between them usually depends on the patient's age, overall health, and lifestyle. In severe cases, surgery may be necessary to repair or replace the valve and restore the heart's normal function. But remember, the best treatment for aortic regurgitation is prevention. Regular checkups, leading a heart-healthy lifestyle and managing underlying conditions that can contribute to aortic regurgitation are key.